Yes.
Yes. Okay.
Excellent.
All right.
Made pizza for dinner.
Yes, made pizza for dinner, Diana. Welcome, everybody. Just watching some attendees flowing in here. So welcome. Diana, we're just talking about what we were making for dinner, what I made for dinner. In typical Italian fashion, I made some homemade pizza. So that was on the menu tonight.
Mm-hmm.
So Diana, thank you.
No problem.
Seeing a lot of people streaming in here.
Excellent.
Hope everybody is enjoying this weather. The final days of March. It's getting one day closer to April. That was my mantra back in December when we had a nice day. So we're one sleep closer to April, and hopefully by then we'll have some better weather.
Finally.
All right. Welcome, everybody. Seen some familiar names from seminars past, and thank you again for joining us and your dedication to these webinars. We really enjoy doing them. It's been a fantastic series, and thanks to Diana, who actually did our last webinar. That was GLAD, right?
Yeah, GLAD and osteoarthritis.
Osteoarthritis, yeah.
Yes.
So these are great webinars. Always take something away from them, and it's a great way for our clinicians to showcase their talents. We've done a lot in the community over the last couple of years, and this actually started. This is kind of an anniversary. When COVID started, we started doing these. I think, hey, Diana, it was right at the beginning of COVID. It was something for us to stay connected with the community. It's been a couple of years now we've been doing it.
And everyone's had really good feedback too about the webinars. So I think that's really important.
Yeah, it's been great. So we're just going to wait a couple more minutes here. I really appreciate everybody for started. Thank you, Jackie. I saw that typed in the chat. I really appreciate the feedback. Reaching as far out as Stouffville, now as far north as Bradford, and great community up in Bradford. We started there in Bradford in September, and really enjoying. And of course, the original, my one and only Nobleton. Thanks to all the Nobleton participants tonight. It was 18 years ago that Nobleton was started off. So anyway, enough about that. Enough about me. We will start with our webinar. So thank you for all the attendees. I will allow people to join as more people probably finishing up their dinner or pouring a glass of wine. So I will turn the floor over to Diana. Just one more question here. Thanks for the gift of education. Thank you so much, Patty. Appreciate it. Okay, so tonight, brought to you by Diana Alonzi, is the Osteoporosis Survival Guide to Moving Better. And so without further ado, actually, maybe we'll just go a little housekeeping item here. Thank you so much. Please, a couple of you have already done this. Type into the chat any questions you have. If it's a burning question that can't wait to the end, please ask them as we're going through. Raise your hand, type into the chat, whatever you feel is necessary to get my attention, and or just tell me to be quiet and I will. Okay, I'm going to turn this over to Diana because you guys are patiently waiting here. So thank you very much, and the floor is yours.
Yes, thank you, Giacomo. So as Giacomo mentioned, my name is Diana. I am a registered kinesiologist here at the clinic. I went to York University and graduated a few years ago. Upon graduation, I became a licensed kinesiologist, and I have a number of hats at the clinic, but primarily my role is in exercise therapy and bracing and working with patients with chronic diseases. I'm also the OsteoPro program director, and I've also created the OsteoPro program, which you will hear more about later on in the webinar, so make sure you stay tuned. And of course, Giacomo, our clinic director. So that's who we are, and we'll get started. So today's agenda: what is osteoporosis? Common signs and symptoms of osteoporosis. What are the current treatment options available for osteoporosis? What is the OsteoPro program and how it can benefit yourself? We'll do a live Q&A after all of this, and then our giveaway. So stay tuned. We have a great giveaway this evening. So please make sure that you stay tuned for that. Okay, so we're gonna get started with some questions. So we just kind of want to get a demographic of our group here this evening. So feel free to answer the poll questions that will come up on the screen.
Bear with me here.
Perfect.
Oh. Okay. Hope you guys can see that. You see that there, Diana?
Yeah, I think this is the results.
Oh, there we go. Sorry. Okay.
Perfect.
There we go. Sorry about that.
So take a few minutes here to just fill this out. That way we can get a better understanding of our demographic here this evening. Perfect. And whenever you see most of them come in, Giacomo.
Okay, so I'm starting to see some results here. We got we're almost done. Thank you. Okay, so we're just going to end the poll here. Oh, a couple more people answering. We'll go ahead and end the poll and share some results. So share the results. Here we go.
Excellent. Okay, so big group there between the 56 to 65 age range. That's great. Okay, lots of people have been diagnosed with osteoporosis already. That's on the poll. That's even better. Can you see that third question there?
Yep.
Okay, perfect. So we'll get started.
Okay.
So what is osteopenia and versus osteoporosis? So as you can see here on this slide, we have our normal bone here. We have an osteopenic bone, which is in the middle, and then our osteoporotic bone here. So osteopenia is a loss of bone mineral density. And it's usually between 1 to 2.5 standard deviations from a normal bone density. If you have fewer minerals in your bone, you should be getting these types of scans done, which you'll likely find out through your doctor. So osteopenia does not always develop into osteoporosis, but it can down the line, which we'll get into more as we go along. And in osteoporosis, as you can see, you're more than 2.5 standard deviations or less from the normal. So what is osteoporosis? So osteoporosis is the deterioration of bone tissue and low bone mass, which can ultimately lead to an increased risk of bone fracture. People with osteoporosis can typically have a reduced quality of life and lower self-esteem, and they can also have a loss of mobility. So osteoporosis can affect anyone at any age, but it's most likely seen in those 50 plus. 1 in 3 females and 1 in 5 males are typically those who are diagnosed with osteoporosis and are typically the population that we see, which is also over 2 million Canadians. So that's very alarming. As well, just another point, it can affect any joint in the body. However, it most commonly affects our spine, our hips, our pelvis, and our wrist. And they're all significantly more than heart attack, stroke, and breast cancer combined. So osteoporosis is a major disease, and it's quite a common disease. There is a little bit of an alarming statistic that has come across as well. Those who suffer a hip fracture with osteoporosis typically pass away within the first year, and that's only about 28% of women and about 37% of males that would. So don't take hip fractures lightly. If you have received one, please make sure that you get the proper care that you need. And osteoporosis is often referred to as the silent thief, which we will get into later on in the slides. Okay, so it's a progressive disease that affects the bone's ability to reproduce bone tissue. Bone is constantly being broken down and replaced, and it occurs when new bone production cannot keep up with the old bone loss. When we're younger, in our 20s and 30s, that's when we reach our peak bone mass and our peak bone density. But after the age of 30, our bone production does slow down, which ultimately will cause those weaker bones. So we're just going to go through what happens to the bone with osteoporosis. So there's two portions of the bone, two main components. So there's cortical bone, which is the outside of our bone, okay, as you can see in both of these photos here. And with osteoporosis, the cortical bone, which is known as the hard bone, it actually thins. So it'll turn into this photo here on the left. The thinning of the cortical bone actually diminishes our bone's ability to resist any kind of fracture that occurs. And the second part of the bone is the trabecular bone, which is the inside part of the bone, and it's also known as the spongy bone. Okay, so this with osteoporosis ultimately decreases the overall strength of the bone. So those two components there. And if you have any questions along the way, just feel free to type them in the chat, okay? So common symptoms. So typically there are no symptoms with osteoporosis. Majority of people that have osteoporosis don't know they have it until they either receive a fragility fracture or they've gone to their doctor and had a bone mineral density scan done specifically because they've likely asked for it if someone in their family had it. But yes, that's why it's known as the silent thief, because we generally don't know that we have it until we sustain a fragility fracture or we go and get a bone density scan done. What fragility fractures are? They are very spontaneous and they can occur from unexpected events, daily activity events that happen. So such as reaching, bending, twisting. If you have osteoporosis, these kinds of movements can cause fragility fractures. Coughing and sneezing, believe it or not, can also cause fragility fractures as well. They can also result from low energy trauma. So this is falling from a low height. So a standing height, for example, we should be able to fall from a standing height without damaging our bones. Those with osteoporosis sometimes may receive fragility fractures from this. And also from a walking speed or less. So whether you're falling while walking or even at that speed, that cadence that we have, it doesn't necessarily need to be while you're running. So some common symptoms. Once bone has been weakened by osteoporosis, some symptoms can include back pain, lower back pain, upper back pain, depending on where majority of the osteoporosis is. Decreased height is another common symptom. Generally lose between 1 to 3 centimeters with osteoporosis. A stooped height, so we've gone from this lovely standing position to more of a crouched, bent over, leaning over position, which sometimes you may also need a walking aid for, and broken bones as mentioned previously.
Hey, Diana,
Yes.
we just have a question in the chat from Lynn. She asks, can you have osteoporosis in your spine, but not your wrist or hip?
Yeah, so from what I've understood from the research so far, it can affect certain parts of the body. It doesn't have to affect all joints, but it can also affect all joints overall, or all bones per se.
Perfect. All right, thank you. Thanks, Lynn, for that question.
Okay. So there's a few risk factors. We have unmodifiable risk factors, which are our age and our sex. So females tend to be more susceptible to osteoporosis than males, and anyone over the age of 50 as well. Our body frame size, so those who have more of a petite build are more likely to have osteoporosis. Family history, so previous history of osteoporosis will make you more susceptible to getting it down the road. And also our race, so Caucasian and Asian descent are also more likely to have osteoporosis or develop it down the road. And there are other osteoporosis risk factors, which are modifiable. So these are things that we can change to help reduce our risk factor, help reduce getting osteoporosis. So sedentary lifestyle, smoking, and excessive drinking. So these are all factors that we can change. We can go to our next poll there.
Okay, let's see if I can get this one right this time. So we're going to relaunch the poll. All right. Okay, there we go. All right, while we are waiting for the poll results, we have another question here. So having surgery on knees, bunions, and a wrist carpal tunnel surgery, indications to osteoporosis. I mean, I'm happy to answer that question because I had experience with carpal tunnel. I had surgery. It wouldn't be an indication for that. Having the surgery on the knees depends on what you're having surgery for. If it's osteoarthritis, that's different than osteoporosis. Then those would be two separate. You can have those concurrently, but having surgery on your knees for bunions is what we call hallux valgus. That's usually from the shape of your bone and your first toe starting to deviate, and so those would not necessarily be indications for osteoporosis, more from a wear and tear type thing. And then carpal tunnel would be from an entrapment of the median nerve through the carpal tunnel in the wrist. So hope that answers your question. I'm going to stop the poll here. I'm going to share the results. So there we go. Just the one question.
So some people are taking vitamins, lots of home exercises I see, and also some medications and injections. And a few people want to learn more too, so that's great. Excellent. Were there any more questions, I think? Just the one? Yeah, that was it. Okay.
There's one more question from somebody else. But we'll go ahead and Joanne, if you're listening, I can try to answer that as Diane's presenting.
Perfect. Okay. I'll get you to take down the poll there whenever you get the chance.
Yeah, sorry about that.
That's okay.
Here we go. All right.
So treatment options for osteoporosis. So this is part of our osteoporosis management. So the first treatment option, so you've gone to your doctor, you've likely had x-rays done, bone mineral density scans done, and likely some blood work done, and they will, first line of action is to prescribe you likely some medication. So we'll go through some of the medication treatment options that are out there. So the first one are biophosphates. These are anti-resorptives. And it's one of the most common families of drugs to treat osteoporosis. There are 4 different ones that are currently on the market that are approved, with the most common one being Fosamax. So if you have osteoporosis, it's likely that you're going to be taking one of those. Then there's the denosumab. These ones treat the thinning of our bones. And they inhibit the osteoclast formation. And another common name for this one is prolia. There's two other treatment options available, which is hormone therapy, either estrogen or a combination of estrogen and progestin. And then there's also bone building medications as well. And some of these medications are also in an injection, and usually they're only once a year that you would take the injection opposed to taking them daily. So another way of managing our osteoporosis are through vitamins. So the two major vitamins we need to be having when we have osteoporosis are calcium and vitamin D. And these two are usually consumed together. So adults between the ages of 19 and 50, we require about 1,000 milligrams of calcium daily, which we can sometimes get already in our foods that we eat. However, if you are deficient and your doctor sees that you are deficient, that's when you would take a vitamin supplement. And anyone over the age of 50 would consume 1,200 milligrams of calcium daily. And vitamin D, so between the ages of 19 and 50, we want to be taking between 400 and 1,000 international units daily. And those over the age of 50 or younger, depending if you're at high risk for osteoporosis or you've had multiple fractures over the years, this is where you would take an increased amount of vitamin D between 800 and 2,000 international units daily. Okay, so nutrition. So protein is also a very important nutritional factor that we should take into consideration when we have osteoporosis. We need to be having adequate protein as it helps build stronger bones and our bone mass. In combination with calcium, it will provide the best result for this, and it is essential for our muscle mass to build good, healthy muscle. So increased protein, if we increase our protein intake, we will get increased muscle mass, and increasing our muscle mass will be able to support our joints better, which will ultimately decrease our risks of future falls and fractures. So if we have enough support around our joints, we are less likely to fall. And when that happens, we will be less likely to receive a fracture. Lifestyle changes that we can do. So we can limit or decrease our alcohol consumption. Smoking cessation is a very big lifestyle change that is recommended, as smoking actually decreases our bone mineral density as it is. And then we also want to prevent falls. So we are making sure we are getting proper ambulation. If we need to use a cane, we are looking out for slippery areas, also wearing proper footwear to prevent our falls.
Diana, there's a couple questions in the chat. I answered one of them, but we had a question from someone asking about our plant-based calcium pills as effective as, I'm assuming, non-plant-based calcium pills. Do you have any comments on that, or?
That's something I'll have to look into. I haven't done too much research on the difference between the two. But if you want to let me know, I would be able to reach out to you. I'll see your name in the chat there, and I'd be able to see some more information for you. Thanks
for that, Diana.
No problem.
And Jackie had mentioned working out twice a week with a personal trainer, kinesiologist, and that's something that she looks for. She's saying hoping this is helping her, and assuming that exercise, as you had mentioned, is one of the keys. And I guess you'll go into that a little bit more.
Yes.
So, yeah.
Yeah, we'll get to that part soon.
Perfect. Thank you. Yeah. Yes. Thanks for all the questions, everybody.
Perfect. Okay, exercise. There we go. Good timing. So exercise is beneficial at any starting point, regardless of your age. Ideally, you want to be starting exercise at a younger age, because it just helps produce our bone cells and will help build our stronger bones. It increases our bone cell production and it slows down our bone loss. The types of exercise that you're doing is also very important. So you want to be doing weight-bearing exercises. And you also want to be doing exercises that have a lot of balance and coordination in them as well. We'll get into more detail about those two later on. And for our final poll,
okay, all right, so okay, there we go.
Perfect. Take a minute here to answer these and we'll get into some more exercises that we should be doing.
So yeah, one of the things I remember hearing at a conference once, discussing bone mineral density in men versus women and how important it was, and it was from a female orthopedic surgeon who was discussing, it's, as Diane had mentioned, starting early with exercise is so important. I think in certain generations, and our listeners would probably attest to this, certain generations, women were not encouraged to exercise as young women, where boys were encouraged to be rough and tumble and exercise, and that helps with bone mineral density. Falling and learning to fall, playing with sort of resistance type exercises is super important. If being sedentary is not, so that helps. I do recall that being brought up. So encourage your little girls to wrestle and be rough and tumble a little bit, right? Mm-hmm. I know I've encouraged mine too. So I'm gonna end the poll here, Diana, and share the results.
Excellent.
All right.
Okay, good. So not too many people are limited with their functional activities. Are you currently participating in an exercise program? Yes, perfect. Some people are, which is great. And that third choice there.
Let's drop down here, sorry.
No, that's okay.
All right.
Perfect.
So I'm going to stop sharing here.
Excellent.
Perfect.
Okay. So OsteoPro. What is OsteoPro? So OsteoPro is a program that I've developed here at the clinic. It's education and exercise that we go through. So additional education to what you've learned this evening, as well as some core exercises that are essential and extremely beneficial for those who have osteoporosis. So education will go more into medication, spinal sparing. We also discuss best practice guidelines and lifestyle management and changes that would be optimal for someone with osteoporosis. So what is osteoporosis again? So in the exercise portion, you're one-on-one with the registered kinesiologist, which is myself. I've done additional training in osteoporosis management. I've been trained through BoneFit, which is recognized through the Osteoporosis Canada, sorry. So we go through a thorough functional assessment. So we do overall strength testing, and then we also do functional assessments. So we see if you're able to get up off the floor, if you've had a fall, and other functional abilities that you currently have and what your goals want to be.
Diana, sorry to interrupt you, but just going back to that previous slide, we had a question from somebody. Just maybe if you can just highlight a little bit, what is spinal sparing?
Yes, so we're doing spinal sparing is activities that we do that we have to limit in order to make sure that we don't put our spine at risk of fracture. So spinal, if we are going into excessive flexion, extension, rotation, these can all put our spine at risk of receiving a spinal fracture. So we go into more in depth about how we can, prevent these fractures from occurring. Yes, how we can prevent and limit these motions. Hope that answers your question.
Thanks, Diana.
Thanks. So back here, yes, so we'll go through a thorough functional assessment, and then we go through exercise. So it is a 4-phase program that we go through. Spinal strengthening are very specific exercises that we do to help support our spinal column. Overall body strengthening, balance and coordination, falls prevention, and then it's also specific to your goals and what you want to get most out of the program. Yes. So why choose OsteoPro? So it'll help reduce your risk of falls and future fractures by learning those spinal strengthening exercises, and also learning how to properly fall, how to catch yourself if you fall, how to reduce your fall through balance and coordination, improving your overall strength. As I had mentioned earlier, good muscle support will support our bones, which will also support our bones if we fall, and it will help them not get fractured. Confidence, we want to increase your confidence as well. Sometimes it can be intimidating finding out that you've just been diagnosed with osteoporosis and you're not too sure what to do next. So, or if you can do certain activities. So we want to make sure that you're confident to go about your daily life with no issue. And then we also want to help you achieve your goals. Okay. If you have any questions?
Yeah, so feel free. We've had some great questions so far. Really astute questions. So if you have any other questions, please type it into the chat. Raise your hand, or if you want the mic, I can give you the mic if you want to speak to Diana specifically. Or if you have any questions regarding the program itself, the OsteoPro program itself, I think it's a fantastic program. As Diana mentioned, there's just having an ability to learn how to getting up off the ground. It sounds crazy, but sometimes that's something that requires a little bit of knowledge. And if you are knowledgeable about what you may have going on, this might help you. We have a question here in the chat. How do you deal with rotoscoliosis caused from osteoporosis?
Yes, so I think I have received an email about this earlier today, and I had actually had a conversation with Stephanie about it. I need to do a little bit more research into that, but it definitely depends on what's going on with your rotoscoliosis. So I don't have an answer for you yet, but I will be able to reach out to you once I do.
Yeah, thanks for that question, Diana. We'll record the chat here after, and we'll make sure we get back to you on that. And so we also had a question. How do I enroll into the OsteoPro program, and some costs, and how long is the program? So those are 3 separate questions from 3 separate attendees. And so I'll let you. So that was how do we enroll? How long is the program? And then what's the cost associated?
Perfect. Yeah. So to enroll, you just call your respective clinic closest to your house is probably the best option. And you just let them know that, you want to do the OsteoPro program. They'll take down some information from you and they'll book you in to my schedule. So it's quite easy, not too much on that side. It is one-on-one though. How long is it? So that actually depends on what your abilities are. So some people may have different lifestyle abilities that we can't do the whole phase of the program. It is 4 phases, about several weeks, I would say, at least probably around 4 to 6 weeks, depending. If you want to do longer, you can. Yes, so that's pretty much the duration of it. We do start off about once a week. We can increase to twice a week if you would like. And we just basically build a repertoire of really good strengthening exercises, balance coordination exercises, also lots of education. There is so much educational material I have that I would be able to give to you about osteoporosis, as well as lifestyle changes and stuff that we can do towards it. The cost of the program, so the initial assessment is $100. And then the treatments, there's 2 treatment options. We can do either an hour session together or we can do a half-hour session together. That just depends what I see from our first session of how long I think our next sessions should be. And they also can change. And the 30-minute session is $65, and then the hour session is $90.
And just I just answer a couple other questions. Somebody asked about what the location of the program. So we'll provide that information in the next couple of slides. So either in our Nobleton location, Aurora location, or Bradford. And I think, Diana, there was maybe somebody was doing something virtually as well. So you
Yes.
had some. There was a question about doing it virtually. So if you're living further north or further south or wherever it may be, you can if you have somebody you want to do this with, you can always tie in virtually. There's another question here. Bear with me, everyone. Thank you so much. It's a great questions. I'm just getting to them. Home exercises, Diana. Somebody's asking about will there be home exercises provided?
Yes. So most of the exercises, especially the spinal strengthening exercises, I need to teach you in person to do these, but there is a home exercise program that you'll work on each week. As you progress and get more comfortable with those exercises, we just add to your repertoire and they get more challenging. But that's a good thing that they're getting more challenging because you are increasing your muscle strength in those areas. So there is a home program that you'll do with the in-person program as well. If you're someone that, isn't able to come into the clinic too often, we can definitely work on something that would be, a more sustainable program for you to do at home, whether we touch base like bi-weekly or monthly. We can definitely figure out whatever option works best for you.
And a question about somebody's asking here, having osteopenia in their hips and has managed to prevent it from turning into osteoporosis.
Amazing.
Is there something else? Yeah, is there something else it should be doing to stave off this disease?
Pretty much any weight-bearing activity is tolerated. Exercise, making sure that you are continually consuming those proper amounts of calcium and vitamin D, and having a healthy nutrition. Those are all really great things that you can continue to do. I think weight-bearing exercise, though, is that main one that everyone should be doing.
Mm-hmm. Great. Okay. All right. Thank you for the questions, everybody. They've been coming in furiously here. Hopefully we're answering and getting back to everybody here with respect to their questions. Once again, I apologize if I'm feverishly trying to type into the chat here, but Diana is of course available beyond today to answer any questions personally, or even just pick up the phone and call her. We would say advice is free. Just pick up the phone, give her a call, schedule a time with her. There's all the contact information, particularly down here at the bottom.
Yes, my email's down here as well. So easiest way, yeah, usually is to reach me by email.
Dana, this is an interesting question. Sorry, and I love this. I love that this is probably the most the most questions we've had to our panel here. So somebody's and none of these are silly questions. So I'll say that first off. But is there a chance from having osteoporosis and then regressing or actually improving, I guess, to osteopenia? So bone mineral density increasing to the point where you change from those standard deviations, where you move back in the bell curve? Yes.
So you can definitely improve your standard deviation from osteoporosis. I think it depends how much you're actually doing to get into that osteopenic stage. But I have seen through some research articles where people have actually through exercise been able to decrease the severity of their osteoporosis. They're still considered osteoporotic, but they're not high risk anymore. They're at a low risk of osteoporosis instead. So you can definitely decrease your risk level by increasing your T-score. So let's say you're at -2 standard deviations, you could be at -1.5, and that could definitely decrease the level of risk that you have with osteoporosis.
Thank you, Diana. We're still available. We have more time left here. I think Diana's done most of the presentation here.
We do still have our giveaway too, so.
We do have our giveaway, and yeah, it's Diana's going to talk about that. But I just wanted to, and I'm fielding some more questions here, and I will just want to thank Diana first of all, in case any of you are, well, stick around for the giveaway. But I want to thank Diana for the information, and people have been thanking me in the chat here for all the information provided. It's a disease, a silent disease that nobody talks about, because it's it doesn't have that cachet. Talk about osteoporosis. It's nothing happens until something happens, right? Nobody knows they have it until it happens, and when it does, it's pretty catastrophic. We see this in clinic all the time, where people have fractures and then go, I didn't know I was osteoporotic. And lo and behold, they are, which is not, again, maybe those things that don't always affect us in our mortality rate, but knowing about the hip fractures and the mortality rate associated with hip fractures is really important. A couple more questions here. Let me just get through it. Oh, there's quite a few. Okay. She's question here says, been watching and aware of osteoporosis for 20 years, as her mother had it very bad, and her BMD, or bone mineral density, was only saying osteopenia, and the next thing I know, I had 8 fractured vertebrae from gardening. Yeah.
Yes, unfortunately, that can happen.
Yeah, those are things that sometimes, again, not preventable in some ways, but diagnostic imaging, as we always say, is not perfect, but certainly if you have a knowledge about these things, then again, this is a great program to talk to Diana about. I think a lot of physicians probably don't have the time to spend to assess these things with you and movement patterns, and this is where Diana's expertise comes in, where you can discuss these in detail. Absolutely. About preventing any type of deleterious effects. So I will, thoughts on Aquafit. What do you think?
Aquafit's good. However, you do not have the weight bearing component that's needed for osteoporosis. And the reason being is that when you're in water, gravity is taken away. So gravity that's coming down on us as we stand normally, that helps create that weight bearing portion. So Aquafit is really good for someone that might have osteoarthritis and can't handle being, on a weight bearing position because it's hurting their joints. But in terms of osteoporosis itself, we do need to have that weight bearing component.
Perfect. Thank you. Thank you very much. All right. Okay. Great. Diana, let's everybody congratulating on a great webinar here. So thank you very much. Let's get to the giveaway here.
Okay, yeah. Just giveaway time.
Yeah, let's just if you are interested in Eric is clapping silently. I can give you the mic. But if you're interested in any more information, just type into the chat, so we know specifically. Just put info in the chat. Diana will get back to you within a few days, or the webinar is available. It'll be available probably in the next week or so. We're going to try to get it out on the weekend, and so you can grab the information. Diana, just one last question, just really brief about what exactly with the OsteoPro program are you assessing?
Yes, so I'm assessing your functional ability specifically. So seeing how, like, I do a strength and like a bit of a neural assessment just to rule out any other issues that may be going on, but I want to see how you're moving. So cardiovascular, balance, coordination, your strength. Those are all things that we primarily assess first, flexibility. And then from there, all these assessments are scaled. So we create a baseline, I see where you are, and we want to try and move you up on that. So through the functional assessment, I'll get some normative data, and then we'll just do our best to create a program that will help increase your ability to do certain activities, depending too. It's like, if you want something that's more cardiovascular, we would assess more cardiovascular, but if you are looking for more strength or flexibility, coordination, balance, we also do that as well.
It's pretty tailored to what people like.
Yeah, it's specific for what you would like out of the program.
Right.
Yeah.
Okay. Okay. Without further ado, we will do a giveaway.
We'll do the giveaway. Yes. So the promotion that we have going on right now. So anyone who signs up for the OsteoPro program within the next 2 weeks, so by the second week of April, you'll actually get your bands for your exercise equipment free of charge. There will be no cost for those. So do your best to sign up if you'd like. We'd be happy to include those bands there for you as well. And I'd be happy to be working with you too to help manage your osteoporosis.
Great.
Yes, and you can type in bands too in the chat here if you're really interested in it. I can also reach out to you that way as well if you want some more information. So feel free to do so.
And thank you very much. I want to thank everybody for participating tonight. We have a raised hand here. Sorry, I'm Judy. I'm gonna answer your question here in the chat. So, just 1 second. But just wanted to thank Diana for a very informative presentation. It was wonderful. Once again, just feel free to reach out to her on email or a phone call, and she'll schedule some time to talk to you specifically. I think that's it for now.
Thank you all for joining us this evening. And again, if you do have any questions, feel free to email me. My email is down here below, or also you can call one of the clinics and I'll be happy to get back to you as soon as I can.
Great.
Perfect. Awesome.
All right, I'm going to be signing off. So thank you very much, everybody, for participating. Appreciate it.
Thanks.
All right.